The Music and Health Research Institute is one of our most interdisciplinary institutes at the University of Ottawa. It brings together a truly interdisciplinary team that fosters collaboration and exchanges in different fields of studies such as arts, social science, natural science, and it does so in a very innovative way through music. Everyone loves music, and music means something to everyone. Since its creation, the number of organizations in Ottawa, but also beyond Ottawa and Canada, that have joined the MHRI has been and is still increasing. Hence, today the Institute promotes not only an interdisciplinary collaboration between researchers from various disciplines, but also a multi-sectoral partnership between researchers and social and health professionals, governments, NGOs, and international organizations. This is the power of music at its best, and it's also innovation in research at its best. The founder and director of the MHRI, Dr. Gilles Comeau, embodies the vision of music on prescription, one that allows social and health professionals to propose music activities that show significant promise in addressing health issues and contribute in improving our health systems while having a real impact on the well-being of individuals. For the University of Ottawa, the vision that guides the Music and Health Research Institute embodies our notion of social innovation through research. Research with partners, research with impact.
For quite some time now, there has been an interest in looking at how music can have impact on health and well-being, but we were noticing a lack of rigorous research to look into its effect and the lack of knowledge on the best practices to make that happen. At the same time, musicians and music educators were getting more and more involved into healthcare setting, and we wanted to study how they could best contribute to the wellness and the well-being of people that have different health conditions, often with marginalized or vulnerable population. We value actionable research. This is research that is first based on a need. We have people that have a need that could benefit from music programs, and we developed research that will have an impact on the group that we're working with. So it is very much a research that will have a direct application with the people that are participating in the research. Right from the start, when a project is being defined, when the design is happening, is very much a co-design process. People with lived experience with the conditions that we're looking at, people that are taking care of them, health workers that work with them, and of course researchers from different fields of research. And throughout the whole process, with implementation, with challenge, we come back to that group and they help to modify, adjust, develop the implementation. They're there when we start to do the analysis so that they can provide some background knowledge about what we're seeing in the results and how we can make sense of the results we're getting. The collaboration that is being established between organizations and researchers is mutually beneficial. As researchers, we would not be able to conduct any research if we didn't have that close connections with organizations and with stakeholders. At the same time, those organizations and stakeholders have access to the research skills and expertise of our researchers. They have access to equipment. They have access to spaces to conduct the research. They have access to people who can analyze results. So they can also benefit a lot by their partnership with us. While music is something beautiful and something that moves people, we are also taking music very seriously by studying how and why it can have an impact on health condition and on general well-being. By learning more about the Research Institute, I hope that people will see the variety of ways of how music is being integrated with various populations, how it is shaped into many types of intervention, and how it can have many beneficial impacts.
We started in 1999 in Regent Park, which is an underserved neighborhood in the city in near the downtown of Toronto. It's providing kids free access to music education. So we work with about 850 kids across the city. We're in other neighborhoods like Jane Finch. We do a program with kids who have had brushes with the law, so they would be in the youth justice system, working with shelters and other areas too, and expanding. That's why we're really honored to be a part of the Music Health Research Institute, because it gives us an opportunity to not feel so alone in the work that we're doing across the city, and that permeates across the country, really. The mission of Regent Park School of Music is to offer young kids access and a way into music education. Anyone who's taken music lessons know that a music lesson can cost upwards of $80 an hour. So we remove that barrier and make it like $1 or $2 an hour and see what happens. We've been bonding with some of the other community music schools in the Institute, and I've been doing my very best to pull in even more of those community music schools that we know across the country. Make sure they're tapping into all the research that's at our disposal here through this opportunity. We're helping, I think, find that sweet spot of sensitivities when it comes to researching and engaging with community in a meaningful way. Getting ethics approval is the basics in a way for me. It's like really making sure that the trust and the reciprocity between the researchers and the community organizations is right where it needs to be. And that's feeling great with some of the research projects that we've helped just be at the table and shape. The research relationship allows us to validate the work that we're doing. We've been doing it for 25 years, and some donors, some other partners that we have really want to see more than anecdotal evidence of this work is important, giving kids free music lessons. They want to see longitudinal studies being launched, and we're doing just that at the MHRI now. So it's like, it's exciting to me to say, like, yes, like after a 10-year period, what does this look like? What are the impacts that programs like ours have on community? We'll actually be able to share that through some of the work that we're doing here. We're collaborating with some of our other colleagues now in community music, like the Sarah McLaughlin School of Music out in BC, like the Lotus Center here in Ottawa. This is one of the research projects that we're developing through the Institute, is we're trying to analyze the similarities between us so that we could share best practices and create a vision, a stronger vision for what community music might look like across the country. We want to share ideas to save anyone who wants to get in this game a little bit of time. If you're struggling as a teenager, it can help you find your voice, and through that self-expression, it can put you on a path. Doesn't mean you're going to be playing Carnegie Hall or Massey Hall. Some of our students do play Massey Hall. It's more than that. It's deeper. The deeper meaning of finding your people. It can save your life, right? It's like your second family. And we see that way too often for it to just be a fluke. No, and that's what we want to try to, when we get back to the research piece, that's what we want to try to really get to understand a lot better. Depression is real, right? Like, just like anxiety is real. All the challenges that youth face today is like, so we offer these really unique opportunities for them to find themselves. And through that, I really do, I'm not just laying it on thick here, I really do feel that it can save lives.
My motivation for starting Lotus Center was both personal and professional. I've been teaching for almost 30 years now, and I had a number of students with different exceptionalities, autistic students, Down syndrome. I loved working with these students. I loved it. When I was going to start my PhD, it wasn't even on my radar that this was something I could specialize in, because it's not really out there. But my son was diagnosed with autism right when I was starting my PhD. And so as a parent, all I did was research autism. That's what you do. I was experiencing how hard it was to find services for my son. And so I really wanted to create a space where parents or caregivers knew, I can bring my child here. They're going to learn something that's incredibly meaningful to them. And I know that the instructors are in it with us. So our mission is to provide access to music education for people with exceptionalities, the neurodivergent and disability communities. There are a lot of gaps right now in that access. So we do have a music school in Ottawa. We have a main location, and then we have 3 satellite locations where we provide private music lessons, group lessons, camps. All summer we do camps. We also do outreach. So we go into community centers, community schools, hospitals, day programs, that kind of thing, and provide workshops to their existing clientele. But we also have a professional development institute, because the lack of teacher education is a huge, huge gap in this. And we can have an exponential impact if we can educate more teachers that then go on and teach their own kids. And then we are also a research center. I'm also an adjunct professor at the University of Ottawa in the School of Music, and we partner with the Research Institute for Music and Health to conduct research on best practices in teaching students with exceptionalities and the impact that music can have. So my research is qualitative research, so I'm looking a lot at things like how to build community, what sort of impacts on well-being music can have, things like how it can build social connectedness, but also the whole family unit. You know, there's more and more awareness of the impact on caregivers, and for them too to engage, to have something positive to engage with their child is really therapeutic. And so that's, I think, something that's a little bit overlooked. There's more and more research on that, particularly with dementia patients, where the caregiver is part of the music intervention and looking at how therapeutic it is for them. We haven't seen it a lot, though, in people with disabilities. So I would love to see more research to bring that to the forefront too. And you know, policy changes don't happen until the research is there, right? So it's time to start doing the research, which we're doing, and, you know, be able to bring that forward to government and policymakers and say, this is worth investing in.
I'm Carol Weeb, family physician with an expertise in care of the elderly. Have worked a lot in geriatric rehab and long-term care. I'm also a musician. Before I did medicine, I started a music performance degree and continue to perform. And within the Music and Health Research Institute, it started right around the same time that I started a nonprofit called Radical Connections. And Radical Connections brings artists, including musicians, into healthcare. The musicians will come there and perform with the people who are there, and it includes people with dementia, their caregivers, volunteers. There's enough research already that we know that music and social interaction slows the progression of dementia. It's really tempting to just go rogue and say, well, this works and I'd like to do this. But in order to have effective research, we need to agree on this is what we're going to do here, and it needs to have some ability to control that so that you can do it, multiple people can do it in multiple centers, and you can build the number of institutions, the number of people who are receiving a standardized mode of intervention. What I think Dr. Comeau is planning for the Institute is both to encourage those kinds of standardized interventions and standardized outcomes, and then build the research networks. Yeah.
The power of music and movement individually is increasingly recognized. How powerful are they when they are married together? My name is Anne Monahan. I'm a physician in care of the elderly at Briere Health. I primarily work at Briere's Geriatric Day Hospital. We spoke about initiating a program called the Music and Movement Program under the auspices of the Geriatric Day Hospital, where I'm a clinician, to see if we could get that going on the Briere site for older folks who are having difficulties with their memory and thinking, for example, who are increasingly having problems with their balance, who are socially isolated and having more difficulty getting out of their homes, you know.
Let's walk. Where do you want to go? Maybe got in a park. Change.
I'm Dr. Neil Thomas. I'm a neurologist at the Briere Memory Program and a researcher with the University of Ottawa and the Briere Research Institute. I've been very fortunate to be able to collaborate with Gilles Comeau on a project to bring the music and movement program to our clients and patients at Briere. We're gearing up for the research side of things, but we have been able to do a quality improvement project and show that the program's been very well received. It's quite feasible to do in the setting and offer this to our patients and provide them with a very sort of meaningful program that engages them from a mental, social, and physical perspective. And so these are all things that are important to help with brain aging.
So I think, the ultimate goal, obviously, of research is to have it be clinically relevant and to have that knowledge translation. But I think what we sometimes find is that with research institutes that are situated within, for example, healthcare institutions, that sometimes there's a divide between the researchers and the frontline clinicians. So that sometimes the researchers are not necessarily aware of what's happening on the front line, and vice versa. The clinicians feel somehow disengaged or lacking a connection with their research peers. What the Music and Movement Program has offered is a really robust connection between the research and the clinical space. Because quite literally it is kind of like a laboratory that has been situated within the clinical space.
In my work at the memory program, I see individuals with cognitive impairment and dementia. This is a disease we don't have a cure for, but over the last many years we've been finding that there are a lot of ways to modify the progression of the disease and maybe even reduce the risk. And so a lot of this stems from in helping people to engage in mentally and socially and physically stimulating activities. This is a chronic disease. People live with this type of disease for many years. Finding ways for them to meaningfully engage in community activities that support their quality of life is really important as well.
I am seeing on virtually a daily basis how much benefit they are getting on a sort of anecdotal individual level from the program itself. So it's really the ideal manifestation of knowledge translation and of research in action. So I feel so very fortunate to have been included in this whole venture.
For me, I've been excited to be, collaborate on this project with the Music Health and Research Institute, because I think there's a lot of promise in the benefit it could provide to, older adults and adults suffering from chronic medical conditions. What we need to be able to show from this is provide some really strong evidence that these types of programs help, because that will, provide the ability to bring these to more people and really make it part of the sort of care program for people suffering from cognitive impairment, dementia, or other chronic health issues. And if we can show that it benefits them, then that just makes it easier to get it out to more people.
My name's Jane Gazine, and I'm on the faculty at the School of Music. at Memorial University, and I'm also cross-appointed to the Faculty of Medicine. I lead the Better Breathing Choir, which is a choir designed for people with lung disease or wanting to improve their health through singing and gentle exercise. So I formed the choir in 2016 as a research project, and it was in collaboration with a medical student who was interested in doing some research around the benefits of singing for people with COPD, which is chronic obstructive pulmonary disease. Our goal with that group was something very specific. We then broadened that into being more general for using breathing exercises and singing exercises for a broader population. And the way we run the choir is that I work now alongside a physiotherapist. So she and I lead gentle warm-ups in the session. We do breathing exercises and we do some chair yoga. We then do some vocal exercises and then we sing songs. Well, we've done some formal studies and we've also just on a weekly basis have the opportunity to see what people are really valuing in the program. And I think the main thing that comes out repeatedly is the sense of being part of a group, having that support with people who understand what others are going through. And so they received support within the group because they were amongst people who understood what they were going through. I think the thing that I have found most rewarding are those people who joined the group when they didn't think they could sing and yet have become some of our most dedicated participants. Really making sure that everyone really understands that you don't have to be able to sing in tune, you don't need to read music, you don't have to sing in time, you can still participate at whatever level you arrive at. And a lot of people improve a lot over time and they're really excited when they do, but that's not the point. And just watching the joy that people get out of music making, which sometimes when you're working within an academic setting or a professional music setting can be lost, and we sometimes forget about that pure joy that people get when they're singing. And then just watching people leave sessions and talk about what it's meant to them, but it does have a powerful effect on their lives in ways that we sometimes forget.
My department was created in 2016, and the idea was actually to intensify presence of Opéra de Montréal into the community. How can we reach out to the community and make sure that we actually appeal to all groups of people who live in Montreal? And one phrase that I always say is like opera should be an agent of social transformation. What does that mean? What does that mean exactly? So it means that actually we bring wellness through opera, that through creation of opera, through different social programs that we create. So I built these programs whereby we co-create an opera. Co-creation is the basis of what I'm doing, meaning that professional artists are working with non-professional artists and they co-create a collective work of art, which is an opera. But also they use opera as a means to understand better the society, maybe to connect with themselves better. All the impact that opera can have socially and medically for them. We are currently working with the Music and Health Research Institute to document what we're doing. All of these programs, social programs, health programs, have an impact on the lives of those who participate in the programs. But we don't have data with that. And so we decided to pair with the Institute to be able to gather data, to start researching, to see the impact of those programs. So we have two programs currently now being researched with the Institute. The one called Breathing, for those who have long COVIDs, and the other one is with the transgender women, to see how the voice modulates, how it actually evolves from day one to the last day. And what I aim at is to have all of our programs researched by the Institute so that we can document all of the things that we do in health, as well as diversity and inclusion, to see really the social impact of everything that we do with opera.
I am Anna Zumbansen. I am a professor at the University of Ottawa and also the Associate Director of the Music and Health Research Institute. I was trained as a speech and language pathologist in France and then in Canada before, and I worked as a clinician before embarking in my research. And my role is mainly, I would say, to help the main director, Gilles Como, directing the institute, but also to participate with my research program in it. I am leading actually the research initiative called the Practices and Benefits of Singing on Health. And so in that way, a number of my studies I do are contributing to the institute. So be it the effect of group singing on aphasia rehabilitation, Parkinson's. I'm also partnering with Opéra de Montréal. My role here is actually really to be at the Opéra de Montréal to help them showing the beneficial effects of what they are doing already. And so I am helping them to apply some scientific methodology to show the effects that they are feeling, but that they cannot document with the rigor that we can bring as a scientist. I feel that the role of the Institute is exactly this, to put together people from different areas. This Institute is really on a great journey to make music and health more credible in all these relationships it can have between these different groups of people working in that area. In continuation with my clinical work, I actually now do more and more research in the health of singers, amateurs and professionals, and this is why in the lab right now we have a cutting-edge device to do that. This is a laryngoscope. We can look at the larynx, at the vocal folds vibrating in real time. So we are using ultra-rapid video cameras to do that, and the value of that in research is that it allows us to see the real slow motion of vibration of the vocal folds, and so we're able to see if there is any asymmetries or if there are any abnormalities on the vocal folds while vibrating, which cannot be done with traditional laryngoscopy devices. So Gilles Como had really this vision of this research institute. What can be seen in the institute, it's really his strength to bring people together. Bring people together and have them work together towards this vision he has and that he shares so well. So this, I would say, is very inspiring. Yeah, I think to me, the Institute is really bringing something new in the area of research on music and health. I come from a research center that was on music and health in a way, but it was much more concentrated on neurocognitive aspects of music. And so I feel with this Institute, it's like a step towards more applicable research, bringing in, looking at more practices that are actually happening in our world, in our communities. And so this aspect of applicable research is really important in the Institute.
I'm Jillian Beacon. I'm a PhD in human kinetics, and I'm also a Feldenkrais method practitioner specializing in working with musicians, specifically pianists. I apply my knowledge of human movement to help musicians find easier ways to play the instrument that are more comfortable, more sustainable, and more enjoyable. The Feldenkrais method is an approach to sensory motor education that emphasizes helping students to sense and feel themselves better and with greater acuity so that they can experience a greater ease in movement. I became involved in the Music and Health Research Institute as a doctoral student of Dr. Camo's. My contribution is more on the side of musicians' health and wellness, but I think one of the achievements of the Music and Health Research Institute is recognition of kind of the bidirectionality between music and health and music, and its ability to collect diverse viewpoints of how people in these different fields can interact and have positive influence within each other's fields. In my work, I focus on helping musicians to feel better. It's a very multimodal work, so I'm using movement and touch to help people improve not only their physical sense of well-being, but also their emotional and psychological sense of well-being. And not every institute would allow for that kind of holistic viewpoint of work. Often it has to be segmented, especially for research purposes, and this institute really makes an effort to understand the subtlety of the overlap between the different research areas. I think there's a lot that other research areas can learn from people who work in music about how to take what we've learned from research and mobilize it into the community, and how to track how those benefits move through the community, because musicians are used to doing that. And it's very relationship-based, and I think sometimes that's missing in a more clinical research setting. And I think that's one of the most important things that the Institute can bring forward, is the willingness of the researchers there to bring an empathetic view, diversity in the groups of people that it serves, and to make sure that those voices are raised, which is especially important, I think, in today's social context.
My name is Jennifer Johnson, and I'm a violinist. I played for many years with the Atlantic String Quartet and the Newfoundland Symphony Orchestra in St. John's, Newfoundland. I was injured several times during that professional career, and it was always related to what I was doing with the instrument, for many, many hours of rehearsals, moving in poor ways. And that led me to train in body mapping for musicians. And I am now a member of the training committee for the Association for Body Mapping Education. Everything about your hand and wrist is sitting on the end of that wide radius. Body mapping is like a user's manual for the body, because it teaches us how we are designed to move. And that is what musicians really need to know, since they are moving to make sound come out of their instruments many, many hours a day. Body mapping is really important for musicians because so many of us have been injured. And most of that injury comes from not understanding the science, behind this body that we live in and that moves for us in order to make music. And so we end up misusing it and abusing it. So the information in the body mapping teaches has everything to do with correcting these misuses and getting people moving in ways for hours a day where they're not going to be running against the design of the body. There are a lot of somatic methods that musicians have used over the years, even before body mapping, to heal themselves and to move better at their instruments in their music making. But until very, very recently, people haven't understood why these methods have worked. And so the research that the Music and Health Research Institute is doing here is hugely important to discover what is going on in the brain, what changes in the brain when we move differently. These are the kinds of answers that we need to support the teaching that we're doing in body mapping for musicians. I think what's really exciting about being a part of the Music and Health Research Institute is that as a musician who works with other musicians in very practical ways to help them, I get access to experts in research, the people who know how to get funding for research, and people like Dr. Andra Smith, who has a lab at her fingertips and imaging methods where we get to see what's going on in people's brains as they play. The crossover and the bringing together of all of these areas of expertise is just truly exciting. I've always been really excited teaching body mapping to musicians and seeing how it can change their careers, improve their lives even. But sometimes it's been difficult to convince, let's say, institutions, universities, orchestras, bands, choirs, the administration at the top, that this is a really important field. We know that the statistics from previous research tells us that between 84 and 90% of all professional musicians are playing with some kind of injury or have had some kind of injury that affected their career. And so even just that little bit of research is quite powerful. But what I love about the potential for the MHRI is that we collect and discover just some really irrefutable information that we can take to music institutions like that to advocate for musicians' health and get the administrations on board. So that's a really real life situation where the MHRI is going to play an important role.
Six years ago, if you would tell me that I would be in music, in university studying music, I would not have believed you. Music has always been a passion. Now that I'm in university and studying music, there's a chance that there may be more, and that's very exciting. My first teacher said that cochlear implant is like glasses for your ears. It's nothing more, nothing less than just glasses for your ears, and I think I just recall this and it makes everything easier.
I've been involved for a long time in research with children with hearing loss. So obviously hearing loss has the most obvious impact is that hearing loss affects speech and language development, spoken language development, listening, but it has impacts in other areas of life too, social development, literacy, academic functioning. The repercussions are widespread depending on the severity of the hearing loss. So my area of interest has been really looking at outcomes in children with hearing loss and how to provide appropriate interventions to support parents in supporting their children. It's been well documented that music has benefits for typical kids with normal hearing in terms of speech and language development, in terms of speech understanding, memory, cognition, some of which last into adulthood, and there's good research to document that. So we're really interested now through the Music and Health Research Institute in examining what are the benefits for children with hearing loss and whether or not we can sort of improve the rehabilitation process for kids with hearing loss by introducing more and more music and making music sort of a more intentional part, if you will, of the rehabilitation. So oftentimes we used to think, well, children with hearing loss, and particularly severe hearing loss, probably won't do very well in music and won't enjoy music. And on the contrary, we're learning, and again, with advancements in new technology and so on, we've learned from one of our studies, for example, that we've done with parents. We did a survey, and we know that many of our children are engaged in music experiences and enjoying it. We also know that we really shouldn't impose limits. And one example is a young child who went, or a young man now, who went through the pediatric cochlear implant program at CHIO, who learned to develop language. He's bilingual, French and English, and is now a violinist. He's a violinist at a very, very advanced level. And we used to think that probably wasn't possible. And so I think the message there is to not set limits on these kids, that even though it may be more difficult, it may be more challenging, anything is possible.
I'm Alex. I have a bilateral profound hearing loss, and I play the violin. And I'm currently studying at the University of Ottawa in the dual major of music and biochemistry. All of my teachers have always believed in me. They never doubted for one moment that I couldn't achieve what I wanted to do because of my physical limitations. I wasn't treated differently because I was deaf. They had high expectations always, but it was always expectations that they believed I could meet. I can play pieces that I never would have imagined playing one day. My musical journey has always been a team effort. You know, I've always had some kind of support one way or another from my parents, from my teachers, audiologists, you know, from everyone contributed to being who I am and where I am today. Yeah, so you know, it wouldn't have been possible without all of them supporting me. One of my future project would be to pursue a master's degree in violin performance, and hopefully in Europe. That would be one of my biggest dreams so far.